Chuck Weinberg, at what age should you be tested for inflammation? The vast majority of our patients are folks that are in their 60s. Many of them have already had a heart attack or stroke or a positive calcium score. The bottom line is that's too late. You need to know, even in your 20s, if you have insulin resistance, because that's what drives this process in most of us. There are more and more teenagers and even younger getting full-blown diabetes. And for every one of those that gets full-blown diabetes, you've got hundreds, maybe thousands of kids developing inflammation. Most of them are going to get over it because their body's young and they've got a lot of capacity, but developing it most commonly from insulin resistance, most commonly from too much body fat, most commonly from our dietary and lifestyle habits. You can supplement. We talked about a couple of supplements already. You can do laboratory tests. You can provide prescriptions to people, and you can do surgery. You cannot out-stent. You can't out-bypass. You can't out-prescribe, and you can't out-supplement a lifestyle problem. Those things are to be used as a help when somebody needs it, assuming they're working on their lifestyle.